The following program is an independent production. The opinions, comments, and expressions of its contents does not necessarily represent the rules and policies of the Raw Voice Community Radio or their sponsors.
Hola. Hello.
Good afternoon. This is Manny Sarmiento, Doral Biz Radio on Doral Voice Radio. I want to welcome you. We have a rainy day. We got thunder and lightning, and we've got thunder and lightning right here with our guest speaker. I'll bring him up in a second here to talk about some very important information that pertains to many of us. Not me. I'm only 60, but we're going to talk about Medicare in a few minutes. But first of all, I want to let you know, I want to remind you that DoralChamber.org, we have it up to date, and on that page you will see the announcement for tomorrow's brunch and lunch networking event at Top Golf. We've already got over 50 people. There's still room for more. It is an exciting event. We get to network, see some presentations, have a great buffet, amazing buffet. We're having the brisket. I made sure we got the brisket tomorrow, and then we get to go outside and, as I say, whack the ball and network outside at the bays at Top Golf Doral, Miami. So with that, also, I want to remind you of a couple of the things we got coming up. If you are into back to school and you've got some kids, we have one of our chamber members, the Spot Barbershop Academy, is giving free haircuts. That's also on DoralChamber.org. Hopefully Sylvia will show it. DoralChamber.org, you can click and go to the Spot. Free haircuts for kids. For back to school, you have to call and make an appointment. The Spot Barber Academy on 104th and 31st Street here in Doral. Free haircuts for the kids. I'm going to try and see if I can sneak myself in there as a kid, but I don't know if they're going to give me a free haircut, but we'll try. This is one of our newest members, one of our newest platinum members of the Spot Barber Shop Academy. And also, if you like beer, the best place to have beer in Miami, in Doral, is at 107 Steak and Bar. If you haven't been to 107 Steak and Bar, this is an amazing place with great food. Make sure you taste their bacon hors d'oeuvres. They're just awesome. And $25 bottomless beer. They have Whiskey Wednesdays. Thursdays is $25 bottomless beer and Prosecco, I have to say it correctly. At 107 Steak and Bar, it's at the between the Element and the Loft on 107th and 33rd Street. Great place to hang out for bottomless beer Wednesdays through Saturday, 4 p.m. to 10 p.m. These another one of our chamber members. We love you, 107 Steak and Bar, participating in Taste of Doral. Don't forget, go to atasteofdoral.com and you'll see some of our best restaurants in Doral featured with their specials or promos for the month of July and beyond. So we have some amazing restaurants in Doral. I'm sure, Fracisco, our guest, you've tried some of those restaurants, right?
Yes.
Which one you like? What do you like?
I like Sergio's.
You like Sergio's? I love Sergio's. It's amazing. I love their croquetas are the best. And breakfast. I love Saturday morning breakfast. Like $7.99, $8.99, and you get the bacon and the eggs and...
but you have to be there before 11.
The café con leche.
11 is a little more expensive.
A little more expensive? Still good. Still worth it. This is one of the places that hasn't raised the prices much. They have great service. They have the robot bringing your food. And it's Sergio's, a great place on 87th across from...
It's one of the best deals of an amazing... food, definitely.
Yeah.
Amazing service, though.
Yeah, good Cuban food. Their sandwiches are...
This is the best Cuban food made in Miami, I think.
I love their medianoches. We've had all their food. I have not been disappointed one time. And Sergio's Cuban Cafe on 87th Avenue. They have several, but ours is the best.
I like the one in Coral Gables.
Coral Gables? It's been years since I grew up, in that.
I live nearby, and then my kids, every time they come, that's the first stop.
Sergio's, all right. Sergio's Cuban Cafe. Try them out. They're great. They're great people, great community people too. They do a lot for the community. John and Carlos, just amazing family, owned business. Sergio's Cuban Cafe, great place. They also participate in Taste of Doral, so watch out for that. Also, pretty soon we got Taste of Doral magazine, the August edition number 4, coming out. Watch for that. That is going to be a printed edition along with the digital. You can go to atasteofdoral.com and see the July edition with some of the best restaurants in Doral, the best restaurants in Doral, featured on a Taste of Doral and Taste of Doral magazine. So with that said, you've already spoken. So I guess we can finish now, right? We can go home. Nah. Did you bring the boat, or did you I don't know. That was tough getting here today.
Well, actually, the traffic wasn't too bad.
No?
No,
Oh.
but just getting out of the car with a lot of rain.
Okay.
And my swimming is been not so good lately.
Not good swimming. Okay. Well, we had lightning and thunder last night. It was great to sleep with, but not good to drive with. But not bad actually. It was pretty.
No, not bad.
It looks like the water management district did a good job of opening up the canals today.
But the traffic was, I think it was going to be a lot. But no, it's not much changes in traffic. Traffic was fine.
Great, great. Well, this is the second time we've had you on board. This is Fracisco Vega Medicare. Last time we spoke Spanish. This time I wanted to make sure that he didn't put his phone on vibrate.
Yeah, put it, yes.
I can't believe that. Come on, man.
Let me turn it off. I think this is supposed to be.
Okay. Last time we spoke in Spanish. This time I wanted Francisco to bring his program in English because there's a lot of questions about Medicare. I've had some friends and some family members that have turned the age of Medicare. I don't know what that is because I'm young. Okay, 60. Okay, but it is 65, right?
65, and if you are in disability, after 2 years you get Medicare too.
Okay.
Or you have a
well, let's not jump the gun.
Yes.
We'll ask all the questions here. I printed out your pamphlet here so to make sure that we answered all the questions correctly and that we bring great information to the audience. Medicare is, I've seen it from my sister. My sister contacted you about Medicare, and it's just so many questions, so strange, so hard to understand is what I saw. And you seem to make it easy. You have so much information about Medicare, and you know everything about Medicare. So if you have some questions about Medicare, Francisco Vega, VegaMedicare.com. So let's start with you. Tell me about you. How did you get started with this? Why did you choose Medicare? Because you can choose many fields.
Well, first thing, I'm 67, so I already have 2 years using Medicare.
You're 67? I thought you were like 50.
Oh, well, thank you very much.
Okay, you look young. What do you vitamin B12 like I had this morning, right? For the energy? Okay.
No, I think it's a life is too important to take it too seriously.
Oh, okay. I have a little pill called a TTM pill, but I can't say what that is. Okay, if you know Spanish, you know what a TTM pill is, right? Okay, because sometimes you just got to take that pill. Okay.
Well, first thing before I was started, actually, I already registered for Top Golf tomorrow for your network.
Yes, you're going to be there tomorrow.
And in the last most of your network launches have been amazing. For me, it's been a great experience, good contacts, high quality contacts, and it's been amazing. So I think my suggestion is everybody's listening to this, have the opportunity to join you in one of your networks. I think it's amazing, but it's worthwhile.
Great,
definitely.
thank you. And I did not pay you for that, right?
No, not yet.
No. Okay, pay later. Okay. Tomorrow's event is fun. It's one of the best events we've had. You know, the other two that I like, and we haven't been able to have it since the pandemic, is the speed networking at IKEA.
I've been there too.
Yeah, but they're coming back around. I'm not sure if they'll let us do the speed networking. You know, with some of the monkey thing and the Omicron and the this and the that. But that was a fun event, right? Over 100 people.
And it's very productive.
Very productive, yeah.
Because you have a one-to-one network. It's amazing.
Well, it's what we try to do. This one tomorrow also. It's 11 a.m. to 1:30 p.m. So you come in, you get to network. Then after the networking, lunch and network during lunch, we have a small presentation. I don't take up too much time on presentations unless it's trustee luncheons. And then we get to whack the ball. We get to go to the bays and hit the balls. I didn't know how to drive a ball. I've played putt for my entire life since I was like 3 years old, putting, but I can't drive a ball. I got to practice. Did you whack the ball last time?
Well, I try to play golf 3 times a week.
Oh, look at that. That's the best networking there is, right? You got the Trump National here, and now you can practice driving.
Yes, I started playing Doral here, but I try to do it with some friends. And we try to do it during the week because it's less crowded. Yeah. And most of them are semi-retired or retired, so it's easy to do work on the week.
I understand it's great networking, right? So.
Yes, definitely. The thing is, if you have a business meeting with someone, sometimes it's tough to keep them focused on your presentation or your product. or your service. But if you get him out of the office to a round of golf, is almost everybody will accept that. And then you sometimes, right now you can drive two people in the car because, and then you can have a one-to-one for a 9-hole or 18 holes. That's good.
Oh, great.
It could be anyway for 2 hours to 4 hours.
But some people still intimidated by going out to an 18-hole golf course. But Top Golf offers a really interesting way to. You're in the bays. You're there with up to 6 people. You're having your drinks, your food, and your excellent opportunities to network. It's a great place. Top Golf is a great place.
And they have good food too.
Yeah, pretty good food. That's why
we have done that before. Actually, Top Golf. I've been with you in the network there before.
I made sure that we had the brisket tomorrow. It's like a brisket taco. It's going to be. I don't know how they do the briskets, but they have the best brisket. Yeah, it's a good food, good entertainment, networking. Good value, Top Golf.
Definitely.
Now we got to bring them. We got to make sure they renew. They haven't renewed yet. Okay. But I still wanted to have the event there because I try to make things practical and fun for our members. And practical, yes. Most important.
Just being a member of the Doral Chamber of Commerce for me has been a very, very good experience.
Oh, good.
Very
Thank
productive.
you for saying that. Appreciate
Thank
it.
you. No, it's a fact. That's a reality.
I appreciate you saying that.
Yes.
Thank you so much. All right, so let's talk about you though. Let's talk about Medicare.
Okay, how can I get this? Actually, I started in the insurance business a little more than 10 years ago. Actually, my mom was in this business when she became a widow when she was 39, and we were 6 kids, and everybody was. My father was a medical doctor. He has his house paid, car paid, everything was in good shape. He has some life insurance, but no life insurance is enough for 6 kids, no? So my mom, one of her friends, told her, "Why you not getting the insurance?" She said, "I had never worked in my life." She said, "But you have know a lot of people, and your husband knew a lot of people." So that's why she got into the insurance business. When she was 39, she's right now 87.
Wow.
Actually, about 4 months ago, she stopped selling insurance.
Really? At 87?
Yeah.
Wow.
So that's one of the blessings of insurance. You know, you have a good portfolio, and then you get renewals, and that's a good business. And the thing is, I was in the food industry for many years, and my background is in food science and food technology.
Wow.
And after when I was turned 55, roughly, the company make a reorganization. I lost my job, so I worked sometimes selling food ingredients for a while. But then it was an announcement that to become an insurance agent. I said, well, that's a family business, so I can make it a try.
So you did. So you took the reins from your mom, right?
Yes. The thing is that, and they say, well, she was able to educate 6 kids with the insurance, so it must be a good business.
Oh.
So I took my license in 2011, and then from then I started working with health insurance, life insurance, annuities, and then I said, well, I'll be retiring soon. What's the best? The thing more important in retirement is health. Mm-hmm. Sometimes you say, well, if the best investment is in your own health. So I said, well, why don't you get train and focus on Medicare?
Oh, great.
And the reality here, today in this country, every day, 10,000 people or more reach the age of 65. Every day.
And is that the Medicare age?
Yes, 65. Medicare, the retirement are close, but not the different things, different aspects. When you turn 65 and you've been working in this country more than 10 years, you have the right of Medicare. You have access to Medicare. So the thing is, every day, 10,000 people, I think right now between 10,000 and 11,000 people every day become 65. Turn 65 years old, and they are able to get the benefit of the Medicare insurance.
Wow.
So I think
that's a good target market for you.
It's a good target
That's
market.
a good size market.
Yes. But that's the whole country, no? But you have to get the proportion. That would be maybe almost 1,000 people here in Miami, maybe.
But one of the things that I really enjoy about you is when I hear you talk to people. I was there when you're talking to my sister about Medicare. Is that you know what the heck this is because like I told you, it's so confusing. So what's for instance, let's answer some questions, which is really what we want to do here. Is what is the difference between Medicare and Medicaid?
Okay, both are federal programs. Medicare is a right because you work in this country 10 years or more, and every time you pay taxes, a piece of that it will be have is one that goes to federal taxes, and there's a small piece that goes to Medicare. So for 10, if you work in this country for 10 years or more, you've been paying your taxes that includes Medicare.
Oh, okay.
So it does. So it's a federal right that you get because you pay for your taxes.
So that's some of that money is get taken out of my check.
Yes, that's a piece of the action. Yes, Medicaid is a federal program administered by the state, but it's a privilege, not a right. If you have, it is typically targeted to people with lower income.
Medicaid.
Okay. So the thing is, you can get Medicaid at any age, because of your family or your kids, because your income levels that is determined by the federal government, you have the opportunity of apply to Medicaid. They have some restriction on typically your income as an individual should be around $13,000 a year or less. Typically, you have to have a certain amount of money in the bank, $2,000 to $4,000 in the bank maximum. You will have only one house, maybe one car, and so it's a need basis government program for people with need.
Okay, so that because that's a big question right now. We have a lot of people that are in need. Okay,
Yes.
The situation is really dire. Gas prices so high. It's funny because I saw the gas prices. I saw $3.99 on the way here. To go, wow, gas prices are so cheap. But we forget there were $2 under Trump. Okay, now it's like it's a perception of things. Wow, it's cheap because it was $4.99. Last month. It's crazy, but everything's so expensive. Everything. I mean, I love the Chessman cookies, and they were like $3.29. I went to buy one the other, $4.89. So that puts people. And including immigrants, people who just migrated to the country, they're going through the process of getting their green card, or just even our own residents. But I want to talk about the immigrants, since we're in a predominantly Hispanic community here in Doral. So who can qualify for that? If somebody is, for instance, seeking asylum, we have a lot of asylum seekers. The situation in Venezuela with the TPS and. So somebody from outside the country, from Nicaragua, your country,
Okay.
right?
The law says every person who is a legal resident of the United States.
You have to have a green card or
a legal status.
legal status. Okay, so
if-
that's the TPS. What about TPS?
TPS is a legal status.
So they can apply for Medicaid.
No. They can apply for health insurance.
Health insurance.
The ACA.
Okay, Affordable Care Act.
Affordable Care Act.
No, but wait. The Affordable Care Act is not always that affordable.
Well, the thing is the cost of insurance is the same. What happened? According to your income, you have a subsidy from the government. Well, ACA is a if you have a legal status in this country, you have the access to ACA. And you can have the subsidy of ACA according to your yearly income, or to your family income, basically your family income.
Okay. You don't help with that. You can't.
Yes, I can do.
I know. Sometimes I've heard you talk to people, even though it's nothing that you're going to earn monies on.
No.
Because you're a very nice guy.
No. I have a person who works with me who is in charge of the all ACA business.
Oh, okay.
So
all right, good.
They do that. She does
they can
that.
contact you.
Yes,
and you can.
I can guide them.
Okay, so let's be clear. So who can qualify?
Okay. Any person the law says any person who has a legal status in the U.S. has the right to health insurance, period. Okay. What happened here is Medicaid is a federal program that is the administration is in charge by the state, and the state they have some guidelines, but they will, according to the funds they have assigned or they have available, they will be more open or more closed in the restrictions of the people who can qualify that. Sometimes they have more money, they are a little more flexible. They can have maybe people with a higher income to get in, or people with a but if the money is restricted, they will have some restricted rules.
Okay.
But then, if you are you have a legal status in this country, and you came here because you were asked by a family member or a company, whatever way you got here, but it was somebody who said that you were here, and they put an affidavit for you.
Okay.
They put an affidavit that says that
That's your sponsor, basically.
that you're a sponsor,
Okay,
basically,
okay.
but you are not going to use federal funds for your stay here in the U.S. So in that case, that person, in theory, should not qualify for Medicaid, but that person they definitely will qualify for ACA.
Okay. So what is Medicare then?
Medicare is a government federal program, basically, for U.S. citizens.
So it sounds like it's nothing to do with Medicaid. It's a different program.
Definitely.
Just the name is confusing. That's why.
Well,
I was always confused with the
The
name.
thing is, for example, in California, Medicaid is called Medical.
Oh my God, more confusion, huh?
Okay. And,
We can call it Medifla, right?
yes, that's a possibility.
Mediflow.
So
okay.
it's a federal health insurance program for U.S. citizens and legal residents who have lived in the United States for at least 5 consecutive years, including the 5 years prior to applying for Medicare.
Okay, all right.
What are the requirements? You have to be 65 years or older, or under 65 if you have a qualifying disability. Say you got a disability, the Social Security accepts or determines that you are have total disability or have disability, you cannot work. Then after 2 years of having disability, you qualify for Medicare too.
Okay, great. But that has to be official disability via the Social Security Administration.
That's the only possibility.
Okay, all right.
And then, see, you have end-stage renal disease, or you have amyotrophic lateral sclerosis.
All right, you're talking medical terms. Come on.
No,
come on.
that's
what's a renal disease?
One is a kidney failure.
Oh, kidney failure.
Or you have Lou Gehrig disease too.
Oh, okay.
So you can qualify automatically for Medicare too.
Okay. All right. Good. So, and of course, next question is, what does Medicare cover?
Okay, Medicare. That's when the whole confusion started because they have a lot of letters. Okay, the first letter is Part A. Part A is for hospitals and inpatient care.
Okay, dude, wait. Before we start on all this, because I know it's very confusing, do you select Part A, Part B, you have Part C, Part D? See, this is the complicated part that confuses so many people.
That we're going to by the alphabetic letter, one by one. Start with A.
Okay, don't get too technical, okay?
No. Basically,
I heard you say it 5 times. I'm still confused. So let's try to simplify it. So
the thing is, when you get your Medicare card, the Medicare card will have Part A and Part B. Part A is hospitals and inpatient care. Part B is doctors and emergencies and outpatient care, basically. So what happened here is, for example, in this year, Part A has a deductible of $1,556. Part B has a deductible of $233. And then you have a 20% co-insurance for Part B.
Co-insurance means a monthly premium?
No, monthly premium is $170 with 10 cents for Part B.
So why would I choose that if I could possibly have ACA?
Well, because when you turn 65 and you already have 10 years quoting Medicare, your ACA subsidy stops.
Oh, so you cannot get ACA, Affordable Care Act.
No, because the only way you can have ACA if you haven't worked enough in this country, and so maybe you could be more than 65, but you haven't qualified for Medicare yet.
Okay.
So the thing is, the law says you can have health insurance in this country, and ACA will protect you. But it has to be, if you qualify for Medicare, automatically you do not get the subsidy from ACA, from the under 65.
Okay, so Medicare, Part A, Part B. Oh, I have to pay $170 a month. What about if it's somebody that's indigent, can't do that?
Okay.
Elderly person.
Okay. First thing is, you pay that if 2 years ago your individual income was less than $91,000 a year. If you have higher than that, your income is higher than that, it can go all the way to $500,000 a year. Your Part B could go all the way to $570 a month.
Wow, sounds expensive, but at the same time, if you had your personal insurance, it'd be 4 times that much.
Well, but that's the reality.
Yeah.
Here is if you make $500,000 half a year, but you're not paying $500 a month, it's not bad.
So on the way down, what about lower income individuals?
That happened. Then there are several possibilities. A person who qualified for Medicare, maybe that person could also qualify for Medicaid.
Okay. Because of the low income.
Yes.
And need. Okay.
If you qualify for Medicaid, then Medicaid will pay for your Part B.
Well, okay. Now that's getting better because we're having a lot of people with financial issues.
Okay.
The food banks are filling up. Are emptying out, and people are going to the food banks. And
you have that. The option. First option is you can qualify for Medicaid. Every time you qualify for Medicare, you get a letter from Social Security, say this is your Medicare, and then it comes with an attachment. It says, what's your financial situation? Then you put your numbers, what's your income, what's your assets, and then you can send that letter back, and they will pull your records, and they will see, according to your income, you qualify for maybe some subsidy from Social Security for your Part B. It could be 100%. It could be half the amount. It could be 3,000. What you can qualify? That's another option. You can have a reduction of your Part B.
Part B is doctor's visits and outpatient care.
Yes.
Okay. Part A is hospital stays and inpatient.
Yeah, but that time you already pay because you work 10 years.
Okay.
Or more. Okay. Then there's another possibility too. The third possibility is there are several companies with Medicare Advantage plans that they have what they call a return of premium.
What does that mean?
That means that the company will subsidize part of the Part B.
Individual corporations?
Yes, the insurance company.
Okay. Oh, the insurance companies.
Yes, that could be any way from, depending on the state, but here in Miami, it could be anywhere from $80 or $90 all the way to $131 a month.
So it subsidizes that $170.
Yes.
Okay.
But that would be the insurance company subsidizing that. But the moment they subsidize that, some of the benefits are reduced. If you don't have any specific doctors that you want to attend, if you have a specific hospital that you want to be in the network, and if you are in a decent or let's say normal good health, and you are not have any surgery plan in the short term, mm-hmm. and you don't take a lot of expensive medicines, then in your case it could be worthwhile to get that return of premium from the insurance company. So,
but I'm so confused.
No, not so confused. The thing is, they have options. The thing is
wait, is the option to call you?
Yes. Well, actually, our
you answer all those questions, right? Okay.
Our motto is, we give free advice with no compromise.
Okay, love it. Okay. And you've done that many times for our chamber members.
Yes, and we do that. And the thing is, we will take care of you. And after we solve your issue, if you want to do business with us, welcome.
Perfect.
But don't be shy of calling us, because maybe you have a friend, maybe you have a family member who is an insurance agent, and you're going to give the visit to him. But you can always call us, and we'll give you free advice.
I have to say that it's not just bull. You've done it. I've seen it.
Yes,
You've done it. You know, we've so many chamber members that have talked so well about you and how
Well, thank you.
You've done exactly that, and they haven't necessarily purchased from you, but they were very grateful for you. And one of the reasons I wanted to bring you back here in English, because this is so confusing. But they can call you at VegaMedicare.com. The phone number's on there, right? Or 786-661-9307. 786-661-9307. We're going to take a break here, and then we'll come back and talk about the rest of the confusing part, which you are making a lot easier to understand. So I am here with Fracisco Vega. Vega Medicare, if you're turning 65, you need some advice. Trust me. My sister went through this. This was so confusing. Talk to someone who knows. And Francisco, you said your motto is talk to us, and you'll help them. I've seen you do that. Francisco Vega, a Doral Chamber of Commerce Platinum member. And with that said, we will be right back on Doral Biz Radio.
No hay duda alguna que nuestra ciudad de Doral es bella y muy privilegiada. Es una ciudad que nos ofrece a los residentes las mayores y mejores posibilidades. Pero es lamentable que después de 19 años de su fundación, estemos atravesando tiempos difíciles y sin el apoyo de nuestras autoridades. El alto costo de la vida, los precios de la comida han subido enormemente y los sueldos se han quedado estancados, afectando la calidad de vida de todos nuestros residentes. Nuestras calles son más inseguras porque no tenemos suficientes policías, dejando los pocos que quedan mal pagados y sobretrabajados. Necesitamos más policías y que ganen y vivan dignamente con buenos sueldos y beneficios. Necesitamos una buena administración de los recursos de nuestra ciudad. Basta del amiguismo. Los oficiales electos deben de actuar y dejar de hablar. Juntos vamos a llevar al Doral a otro nivel. Anuncio político pagado y aprobado por la campaña de Juan Carlos Esquivel.
¿Eres colombiano y vives en los Estados Unidos? Escucha esto. Majority, la banca móvil todo en uno para latinos, te regala $20 cuando envías dinero a Colombia. Con la app de Majority, disfrutas de beneficios como llamar a Colombia gratis, a teléfono fijo o celular, enviar dinero y recarga sin comisión. Y obtienes una tarjeta de débito Visa con descuentos y cashbacks en tiendas locales. Tómale una foto al código en pantalla y descarga la aplicación o visita el stand de Majority en el Dolphin Mall de Miami, al lado de Old Navy. Ahorra, envía, habla con la app de Majority, la banca móvil para latinos.
Si hay algo que nos caracteriza en el Doral es la buena comida y los grandes eventos. Por eso, impacta a tus invitados con Brunellas Catering, donde encontrarás un menú variado y a muy buen precio. No te vas a equivocar. Llama a Brunellas Catering al 786-329-2913 o búscalos en Instagram bajo Brunellas Catering. Déjales dicho que te recomendaron de Doral Voice Community Radio. El Venezolano News, décano del periodismo de primera por más de 30 años en el sur de la Florida. Búscalo semanalmente en múltiples puntos del Doral o visítalos en su página web elvenezolanonews.com. En estos tiempos difíciles, una celebración puede ser bien costosa. Eternity Events te puede ayudar a decorar y preparar tus fiestas con excelencia y calidad. Llámate a Valentina al 786-991-3967 o búscalos en las redes sociales bajo Eternity Event para que puedas ver la calidad de los eventos que Eternity Events ofrece. Si quieres almorzar sabroso y económicamente, en la 79 Avenida y la 46 Calle del Northwest, restaurante Eurocafé Express. Sándwiches y almuerzos ejecutivos de primera calidad, con buenos vinos y una atención de primera. Visita a nuestro amigo José. Para más información, llama al 786-362-6471. Restaurante Eurocafé Express. Cuando se trata de calidad y prestigio en diseños gráficos, tus mejores trabajos los consigues en Printcraft. Buen precio, rapidez y confianza de que tus proyectos gráficos queden profesionalmente. Llama a Carlos al 954-294-6139. Printcraft, calidad comprobada.
And we are back. My name is Manny Sarmiento, President and CEO, Doral Chamber of Commerce. Got to get close to the camera here. And I want to remind you, tomorrow, there's still a few seats available, not too many. We've got over 50 registered guests already. for Top Golf. We're at Top Golf with our brunch and lunch networking, and our theme for that is we are back again. If you remember what we did the first time we did Top Golf, it was just right after the pandemic. This is a great event. Tomorrow, 11 a.m. to 1:30 p.m. Still seats available. You can go to giraudechamber.org. You'll see the little square, the advertising there. Click on that. And we will have you there playing golf with us, networking, having some of the great brisket tacos, and enjoying amazing people like Fracisco Vega here from Vega Medicare. We're talking Medicaid. So confusing. When I turned 65, that's 5 years, so you're going to have to wait a little bit, 4.5 years. I am coming to you, okay, because this is so confusing. And as I said, my sister's been through it. Some of our family members have been through it. This is the website. The phone number's on there. You have a very, very friendly individual here in Fracisco Vega who will talk to you. Don't worry. He's not pushy. He's not going to try to sell you insurance just to sell you insurance. He's going to educate you and help you answer the questions about Medicare, which, remember, when you turn 65, you qualify. But there's a lot of questions to answer. We talked about Part A, Part B. How many parts are there? Well, we're going to get to Part Z. No, there's no Part Z.
Yes, Part Z. Actually,
Part Z?
yes,
There is?
yes.
Oh, no,
Okay.
no. I definitely. I'm going to contact you. Well, I'm going to contact you from now because you continue to be a member with us with the Girard Chamber of Commerce. And I appreciate that, by the way. You're a platinum member. We work hard for you. You know that. Our motto is we market Doral. You are a very, very important member in our chamber, besides the fact that you put your faith and trust in us. But the information that you have is so necessary to so many people. You said 10,000 people a day are turning 65?
Yes.
Okay,
Or
and
more.
so, oh wow, this is a very confusing topic. Now, I know sometimes you go to an insurance company or a Medicare expert, and they don't seem to be an expert. All they want interested in is selling you. You're different than that, and I will vouch for you. I put that on your Google reviews, and thank you for our Google reviews. I appreciate that very, very much. So let's continue to talk about Medicare. So Part A and Part B, we talked about that. Part A helps you pay for hospital stays and inpatient care. Part B helps you pay for doctor visits and outpatient care. By the way, do you choose A or B, or do they just get both?
No, you have to get both.
You get both. Okay. So now you have additional coverage. It's called Medicare Supplemental Insurance, Medigap. Okay, we already talked about maybe having Metaflow in Florida. No, just kidding. Okay, so that says helps you pay some of out-of-pocket costs not covered by the original Medicare and Medicare Part D. So what is this?
Medicare Part D is drugs, prescription drugs.
Oh, okay.
What happened here, the Medicare does not give you prescription drugs. Medicare, the prescription drugs benefits, you get it through private insurance company. Medicare regulates that. Every company has a formulary that Medicare approve and the conditions of the whole plan. But the Medicare controls and regulates the whole drug program, but it's not a government program. It's regulated by the government, but it's issued by private insurance company.
Can't the government just simplify this thing?
Well, the next thing is...
Oh, by the way, before you get to the next thing, do I choose that? Because it says option 1, option 2. So do I choose the additional coverage? Is that included? How does that work?
The thing is, if you have original Medicare, you have Part A and Part B, you can go to any doctor and any hospital in the United States. But you are responsible for the deductible of Part A, $1,556, and you are responsible for the deductible of Part B, $233, but actually you are responsible for 20% of coinsurance for Part B.
Wow.
If you have like $100,000 procedure in the hospital, then you'll be responsible for $20,000. So Medicare, yes, it covers 80% of your cost nationwide, but that's why you have to get a Medicare supplement plan, or also called Medigap, or you get a Medicare Advantage plan.
Okay, so that's an option I can add.
Yes, that's what we sell.
Okay,
So
all right.
the
good.
thing is, the Medicare insurance is Medicare Medigap or Medicare supplement. It will cost you anyway from $270 around $270 to $300 a month.
Wow. In addition to the 170?
That's correct. But then you have access to any doctors and any hospital in the United States with no restrictions. Any hospital and any doctor that accepts Medicare, you can go there and you can have all your expenses paid. You only pay for the monthly premium.
Okay, but it seems kind of costly. So.
Well, it's costly, but the thing is that doesn't exist. You can have a Medicare Advantage program that here in Miami, most of them.
That's option 2.
Option 2 have zero premium. Because when you get a supplement plan, you have to buy a Part D plan, a Medicare drug plan. That could cost you anywhere from $10 to $100 a month, the drug plan. If you get an Advantage plan, also called Part C, that include Part A, Part B, and Part D. But no,
this is confusing.
No.
Just call Fracisco Vega. Okay, at VegaMedicare.com. He'll explain to you when you're ready.
Well,
okay, I'm glad I got 4.5 years to go before I need you. Okay.
Actually, the people say, and which Medicare Advantage or plan is better for me? The answer is simple. The best plan is the one who has your doctors in his network and who covers your prescription drugs. So people say, that this which plan is better? Is the one that gives you the most benefits for your particular needs.
Okay.
So that's how we help you, because we understand, we try to find out which doctors you want them in your network, if you have any prescription drugs specific, because every company has what we call a formulary that is supervised by Medicare. And that formulary will have at least 2 prescription drugs for any disease, but not necessarily the same brand. So because, for example, you have diabetes and you use a particular brand of insulin, not all the companies have insulin, but they have different brands.
Oh, I see. Okay.
So the thing is, the information is public, but the thing is we have software that we can do that a little faster than you can do, but it's available for you. You can always go to the Medicare website, put out your prescription drugs, and they will show you which plan has a better coverage for you.
I see.
But with us, you can put everything together, your doctors, your prescription, and your particular needs.
Okay, so let me ask you about something which is always a critical question when the federal government talks about, and the state government talks about it, is what about pre-existing conditions?
Well,
I turned 65, I have a pre-existing condition.
Well, for a supplement, if you turn 65, you have 6 months for the plan to accept you. It doesn't matter what is your pre-existing condition. If 6 months goes by...
You said supplement. So you're talking about Medicare or the part...
No, Medicare supplement.
Medical supplements.
No, Medicare will accept you. It doesn't matter what happened, what you have.
Okay, that's the additional coverage. So
Yes.
Medicare will accept you.
Yes.
But you are subject to being accepted for the supplemental insurance, which is what covers out-of-pocket costs not covered by original Medicare, prescription drugs, so that they don't have to accept you.
Well, they don't have to accept you. Yes, if you the first 6 months when you turn 65. After that, you are subject to underwriting.
Which means?
That means that they will look at your medical records. They will see you have any surgery program, and they will evaluate if you are a good risk.
Okay. But Medicare, they have to accept you.
Yes, and the Medicare supplement will have to accept you for until you are 65 and 6 months.
Okay.
It doesn't matter what you have, what pre-existing condition you have. In the Medicare Advantage program, it doesn't matter what you have, what pre-existing condition you have. They have to accept you. Period.
Okay.
So,
Wow, confusing as heck. But once again, we have Fracisco Vega to help you when it comes. If you're turning 65, but actually it says here 3 months. When I can apply 3 months prior
to 65.
to 65. Okay.
The month you turn 65.
So you're going to see me sooner.
Yes.
Good.
And 3 months after 65. But then it will be effective. The first, if you apply 3 months before your month of birthday, it will be effective the first day of the month of your birthday.
Oh, okay.
After that, if you apply in the month of your birthday, it will be effective the first day of the next month.
Okay.
Then if you don't use that period, the 7 months period, then you have every year from October 7 to December 15, you have the option of enrolling or changing your Medicare Advantage plan.
That's through the enrollment period?
Yes.
It says October 15th through December 7th.
An annual enrollment period.
Okay,
And
but change it to what? You have Medicare. Do you have a choice?
Medicare Advantage.
Oh, Medicare Advantage. But Medicare is Medicare.
Medicare is Medicare.
Okay.
But Medicare Advantage plan,
See, I'm understanding more. Thank you.
I know that. The Medicare Advantage plan, you can change companies because your doctors leave the company, or because you have other company has other benefits that you're looking for. Maybe dental benefit, maybe a better hearing aid benefits, maybe transportation, maybe gym. Most of the companies have a gym benefit.
And that's where you can help choose the right one, right?
Well, the thing is that's why I say which one is better for me. Well, let's see who your doctors are and what prescription drug are you taking to help you choose the best option.
And that's what you do. You help them choose the best options.
The other thing is, well, I don't travel. I'm only in Miami. When I travel maybe once a year, okay. If you travel out of Miami and you have an accident in Boston, any insurance Medicare Advantage plan will cover outside of Miami in case of emergency or urgency.
I see. Okay.
But
and Medicare will cover you nationwide, but not the supplemental.
The supplemental, it will cover nationwide.
Nationwide also.
Yes.
Okay.
But this Advantage, it will cover basically locally. If you have an HMO, a health maintenance organization, you have a primary care provider. If you have a PPO, you can have a larger network, and you can do it. You can use the doctors outside of your network, but with an extra pay. But you can use it nationwide PPO.
I see.
So if you have kids located different parts of the country, and you spend time, you only go for a few days there, 2 weeks or for a few weeks, you can have an HMO. If you go there and stay with them several months, and you need to use doctors locally, it's better to have a supplement or to have a PPO.
I see. Okay. PPO, so it's okay. Good.
Perfect.
All right. Question, because this has been a very good informative tool. This flyer that you have, is this on your website?
In my website, yes.
Okay.
Actually, we publish them, but in Spanish in the.
There's a website right there showing again.
In the website, you have all the different parts, all the information in detail.
Is this in Spanish, you said?
In Spanish and English.
Oh, Spanish and English. Okay, great.
We have in Spanish and English. We have a YouTube channel too.
Right on the website?
Yes, you can touch it. You can go to the website. We have a YouTube channel with some of the videos, and I think this video in English today. Well, I'm going to post it there too.
Please, yeah. No, I'm going to spread this because I tell you, there's a lot of people. Obviously, a lot of people. You already said it. 10,000 people a day turning 65. But there's a lot of people with questions of Medicare. I'm understanding it more. This is the third time I've interviewed you. Maybe by the fourth time I interview you, maybe by then I'll be 65 or
you become an expert,
and I'll be an expert, and I know what to choose. Okay, this is really, really good information. The annual enrollment period is October 15th through December 7th, but the Advantage Open. The Medicare Advantage is January 1st through March 31st.
Well, that one, every year you can also change plans. If you already are enrolled in a Medicare Advantage plan, you can, let's say you enroll in October and then it becomes effective January 1st. You can try it for January, February. Say you want to change it, you can change it in March or February. You can every year you have 3 months to change plans too. Okay. Or if you change residence, or if you just, God forbid, you get a chronic disease, or you move to other state, but there are options.
It's special enrollment periods, right?
Special enrollment period. But to make a long story short is, there's a lot of information that we give free advice with no compromise, definitely.
Like I've said, you've done that already. I've seen you do that with several chamber members. You did that with my sister. You helped her out. Thank you so much for that. I had a question here. So let me cover this. Benefits of Medicare Advantage. These are the options. Medicare Advantage. You called it option 1.
Yeah.
Is that officially called option 1?
No. It's called Part C.
Part C. Okay, that's Part C. Okay, and then you have the Medicare plan. Okay, so additional coverage, Medicare Advantage, additional coverage for hospital stays, additional coverage for medical expenses, prescription drugs, vision and hearing coverage, including glasses, hearing aids, and annual out-of-pocket limits. But
Yes.
that's an option. They have to pay extra, correct?
No. For the Medicare, that's you're paying extra. For the supplement, yes.
For the supplement, okay.
You pay supplement extra.
And which is the supplement? The supplement is Medicare Option 1, Medigap.
Medicare, yes.
Okay, and what does that cover?
Well, you have a monthly, but you don't have to pay anything if you go to the hospital.
Okay, so it says helps pay.
Actually, this year, the best plan is called G. You pay $233 deductible, and that's it. And you can go to any hospital, any doctors in the U.S., and that's your total cost.
Okay, all right. Wow. Okay, this is a lot of information. So this, you said that you can download from the website?
Yes.
And
yes,
there's
yes.
also, you have a YouTube channel explaining this.
Yes.
This video, make sure that you get it to you in MP4 so you can upload it to YouTube. This is great information. This is Fracisco Vega, a platinum member of the Doral Chamber of Commerce, and thank you again for that. You'll be there tomorrow whacking
Yes,
the ball,
definitely.
okay, tomorrow at Top Golf. Come tomorrow at DoralChamber.org. Click on the Top Golf announcement. There's still a few spots left. We're going to have lunch and brunch. We're going to network, and then we're going to whack the ball, as I say. Love to interview some of you people tomorrow. We will have a videographer there. And we have invited some of our candidates locally. So we'll see who shows up, so you can meet some of the local candidates for Doral Mayor, Doral Council, and also for District 12. So thank you, Fracisco Vega, Medicare.com. Fracisco Vega's phone number is on there on the website, VegaMedicare.com. I want to thank you again. Do you have a third language that I did interview you with? We did Spanish, no English. So.
No, I know some Portuguese, but not as fluent.
No, yo no falo portugués. Okay? Yo no falo francés. Nein sprechen Sie Deutsch. Okay, I can order a beer in Germany, and I don't drink beer. Okay, so thank you for that, Francisco. This has been great. God bless
Thank you very much.
Appreciate you. This is Manny Sarmiento, Doral Biz Radio here on Doral Voice Radio. I want to thank Juan Carlos Esquivel, Nancy Esquivel, Sylvia, our producer, sitting in the background over there, hidden. She's always doing a fantastic job for us here. So God bless you all. Have a safe and wonderful week. Be careful driving out there. Watch out for puddled and flooded roads. Be safe. God bless you. And we will see you tomorrow at Top Golf for our brunch and lunch networking event. This is Manny Sarmiento, Doral Biz Radio.